Well, let's start. Good morning, everyone, or almost good afternoon, everyone, and a very warm welcome to today's webinar. My name is Sandra Igwe, and I'm the founder and the chief exec of the Motherhood Group. And I want to just thank you all for joining us on our third day of Black Maternal Mental Health Week. And I want to also express my gratitude to our partners at Central and Northwest London NHS Foundation and the Maternity, Trauma and Loss Care Service for helping us co-design and co-host today's session. To begin, I'd like to just hand over very quickly to Grace Nate, who is the lead midwife for Northwest London. She's also a professional advocate in maternity care and also the lead for the Maternity, Trauma and Loss Care Service at Northwest London University Healthcare Trust. Thank you, Grace, again.
No problem. Good morning, everyone, and thank you to Sandra and her wonderful team for coming. I'll be multitasking here, but what I really wanted to just say as a housekeeping, can everyone please keep their microphones on mute? That would be really helpful. We do have a chat, so if there are any questions that you want to ask, just pop it in the chat and we will get those questions answered as long as we have time. If we don't have time, I'm sure Sandra will be able to just do something in the background. I will leave it to these wonderful women. But I just wanted to just really recognize Sandra here because Sandra Igwe is a trailblazing maternal health advocate. She's a TED speaker and the social entrepreneur. She's best known as the founder and chief executive of the Motherhood Group, a pioneering social enterprise dedicated to applying and supporting the Black maternal experience in the UK. Following the birth of her daughter, Sandra transformed her personal journey into a powerful movement, creating safe spaces, culturally sensitive programs, and national campaigns such as the Black Maternal Mental Health Week UK and the Black Maternal Health Conference UK. So we are so pleased this morning to have Sandra and her team. She's bridging the gap between Black mothers and key stakeholders, including NHS England, policymakers, global corporations. I can go on and go on, but I just want to spend this time this morning and give it all to these wonderful, fantastic women and birthing people just to really share their experience with us. So Sandra, you take it away and it's all yours. Welcome.
Thank you so much, Grace, for that wonderful, warm welcome and for that very long bio that you just shared with everybody. I really appreciate you all. Let's crack on because we've only got 45 minutes and we've got a wonderful conversation that we're planning on having. Please do use the chat box as Grace just mentioned. It would be great if everybody could just quickly just type in their name, organization, and what they're interested in today, just in the chat box, so we know who's in the room. Even though we only have about 45 minutes, it'd be great to just know who's with us today. So today's webinar is part of, as you know, Black Maternal and Mental Health Week, and the theme that it runs under is making Black mothers visible. And you guys know that for far too long, the voices and experiences and the needs of Black mothers have often been overlooked or minimalized. And this week is really about shining light on those reality, ensuring that we as Black mothers and Black women are not only heard, but are placed at the center of change, or the change that we would like to receive. And each day focuses on a different theme. And today, day 3, is we are exploring maternal mental health and digital support. And so we'll be discussing today with our wonderful panelists how digital platforms, safe spaces, peer-to-peer networks can really improve access to care, and also to help break down stigma, taboo, judgment for Black mothers. And at the Motherhood Group, we've really seen the transformative impact of support and also digital support through our own platform, our new Black Mums app, which really connects, thousands of women through peer support, culturally relevant spaces, resources, and community. Enough about myself and also about the Motherhood Group. I really want to introduce our wonderful panelists today. So we have the amazing Trish Belusa, who is actually a Mums Advisory Board member for the Motherhood Group, but also a former Big Brother UK contestant, but she's also a maternal health advocate who really speaks around women's rights, as well as speaking about the issues that Black women face in care as a whole. And so just, Trish, would you like to just quickly say hi and introduce yourself before I move on to Fiona Small?
Can you hear me?
Yes.
Okay, hi guys, I'm Trish Balusa.
We can't hear you, Trish. So maybe you need to unmute, if that's okay. And if we can't
Hello, can you hear me?
we can hear you now. Go on, that's fine.
Hi guys, I'm so sorry. I was there yapping away and you couldn't hear a thing. Okay, I'm just going to try and repeat that again. I'm Trish Balusa, as the lovely Sandra said. Kind of started it with the public in terms of reality TV, but before that I've always been a big advocate for equity, for women, for Black people. I'm big on social issues and advocating to kind of like bridge the gap and kind of get rid of any disparities in a lot of categories. So as a mum, naturally, this is something I ended up in because of my own experience as well. And yeah, and I'm here hoping to amplify voices like mine.
Thank you so much, Trish, for being a wonderful advocate, and also she'll be sharing her lived experience on today's webinar. Our next panelist is the fantastic Fiona Small, who is a motivational speaker, a consultant, social entrepreneur, and founder and director of Young Mum Support Network, CIC. Fiona, it's a wonderful pleasure to have you with us again. We keep bringing her back because she has so much insights, expertise, and lived experience. Fiona, if you could just wave your hand and also introduce yourself to our audience today.
Thank you, Sandra. It's always a pleasure. Hi, everyone. Sandra's a dear friend of mine. I love her to bits, and I am a proper girl fan, even though she's a good friend of mine. Well done, Sandra. Love you. Keep going. So I'm the founder of Young Mum Support Network. I set it up 13 years ago. We've been providing transformational programs, supporting predominantly those that are most marginalised, supporting with housing, mental health. At the moment, we're looking into special educational needs and looking at the early years strategy. Sandra and I work and sit on a number of different strategic alliance panels, working with the ICBs and ICS. I'm also a guest lecturer at Greenwich University on the public health course, and I also consult for consultancy. I'm big on agency autonomy and very much around those that don't have access. So this is an amazing platform. I'm super excited to be here. Over to you, Sandra.
Thank you so much for that, Fiona. Brilliant. And our final panelist, apologies, is Susan Ibuake. Susan is an antenatal, postnatal and breastfeeding educator and is the founder of a Mama's House, and she empowers mothers through support and education. She's actually run quite a few classes for the Motherhood Group. Susan, are you here? Please wave and just quickly introduce yourself before we start with our questions.
I'm doing it. Hi everyone. Hi, I'm Susan. I'm an antenatal educator and I'm also a mum of 5. And so I guess through my journey of motherhood, I've just been learning more and more and just been supporting mums in the community, which is what I love. Right now, I'm really involved in supporting research, maternal health research, and encouraging more people to get involved and in co-production efforts as well. So yeah, you'll see me doing online antenatal workshops and classes and stuff like that.
Brilliant. Thank you so much, Susan. I'm going to be asking a few questions and it's going to be really free flowing. Please, any questions that you guys have and you're listening, please write them into the chat box. Felicia from the Motherhood Group will be scanning them and just picking out any questions that we could share towards the end. So I guess my first question is, we're talking about digital safe spaces and maternal mental health for Black mothers. Fiona, what does a safe space for Black mothers mean to you in practice? What does it actually look like in practicality? And why is that even important to have safe spaces for Black mothers?
Yeah, it's vitally important. As you know, Sandra, back during the pandemic, we created a very massive community through Clubhouse, which was digital support. During that time, mothers were super isolated, going through so much trauma, especially those that gave birth during that period. And now we're seeing the relevance and the need of that even more, just because conversations that we want to have in, you know, probably the kind of professional space or just openly, the judgment that sometimes we can feel doesn't feel right. And I think as well, we have a sense of relatability. Like, I can share something with you and I know you're not going to be like, well, that's weird, but you're going to get it and identify it and understand it because you're like, I'm familiar with that. So it is important to be able to, we carry so much as parents. I've got a 20-year-old. She's going to be 21 next month, right? She's going into a second. I know, girls. I know. So she's going to be going into a second year of uni. I'm also an SEN mum of a child who has ADHD, has been navigating the education system, and I've found super support in digital spaces without that feeling of judgment. You've got to realize, as a practitioner who work in the sector, who is very close to some of the issues, especially pertaining to special educational needs, looking at the disparities, the inequalities, and the systemic, institutionalized, and structural racism within the education system. I need to have the safe space to be able to talk and share. And I'm coming up against some real dynamic influencers, professionals that working in the space that are so grateful to be able to share what's going on personally in their lives. So it's very, very vitally important.
Thank you so much, Fiona. I'm just going to probe on that before we go on to Trish. You mentioned, obviously, you're coming against institutionalized racism. How do you know it's that, and what does it look like? I might know the answer to that, but I want you to explain and spell it out for those who might be watching.
It's in plain sight. And equally, can I also say that the professionals know it as well, because they do call it out as well, because they know that had it been, sometimes we're dealing with a postcode lottery, sometimes we're dealing with stuff that the system is doing what it's always done by design. And you and I, who are advocates, passionates, you know, they might call us radical to a certain degree. We're not going to sit down and take it. So for me, it's very important to be able to articulate yourself. You know, even when we're expressive people, we come from expressive people, right? So sometimes we are misunderstood or misinterpreted. And I use lots of hand gestures because it's just who I am, but it doesn't mean that I'm being aggressive. I'm just expressing myself, but to somebody else that will come across very differently. So it isn't something that it's not known, because oftentimes it is that unspoken. And when you call it out and say it, it's not that you've got a chip on your shoulder or you're paranoid or you're feeling, you know, you've got anxiety. It is the fact that the facts are the facts, and it is what it is. And when you call it out, sometimes it's like, oh, did she just say that? Yes, I did, because that's what it is.
Thank you, Fiona, so much for that. Trish, Fiona mentioned, you know, sometimes using her hand gestures, she's perceived as, you know, it could come across like aggressiveness or as a Black woman. And she also touched on being a mother as of a SEN child. And I know that you have experience of raising also a child with SEN needs, as well as openly being called aggressive as well on ITV, a massive national platform, and you having to defend yourself. And I know just through your story, you've touched on in the past going through, you know, baby loss as well. Can you explain and share your story and how all of those themes connect? And then we'll then revert back to the safe spaces theme as well.
I think what was interesting, one of the questions you asked, like, how do you recognize institutionalized racism? At first, I think you don't even know that it's institutionalized. You just assume it's just personalized, is racism towards you. I think this is what's so important about the whole digital thing and be able to have conversation, because when you realize that a lot of people who look similar share similar experience, that's when it starts to become quite clear that this is actually a system. It's not accidental that we just all coincidentally experience the same thing. And I think what's quite interesting about all these factors. I spoke about it at the Motherhood conference last year. It talked about the importance of how Black women are shown and perceived on TV, and how also that also impacts how we're treated within the healthcare sector, because you know we've got these healthcare professionals who are watching these, and they're not limited to ignorance, as we all are. We all have a lot to unlearn, but if something is constantly shown in our TV screens and we're taking it in, and us Black women are constantly seeing people who look like us being labeled aggressive, angry, bitter, even if some of these emotions are normal, like bitter, reacting to something that's unjust, but it's almost weaponized against you to the point where you feel like you cannot speak. I think that's also a huge part of institutionalized racism, where even if you are raising a very valid point, you are almost made to feel embarrassed about it. I think what we saw on ITV Big Brother was me rightfully calling out a lot of the microaggression, but even calling that out, you're then also, there's also a victimization that happens, which I think is a big part of institutionalized racism. Is calling out something that's unjust to you is then puts you down as a perpetrator, rather than actually investigating and seeing what's going on. You're almost demonized for actually speaking out about an uncomfortable feeling that can be quite detrimental if it carries on, as we're seeing within the NHS and the conversations we're having about Black mothers. This is something that starts way before our motherhood journeys. Before we become mothers, some of us are already walking in there planning of how we're going to present ourselves so we are taken seriously, even before experiencing motherhood before, because we're so used to having to prep ourselves in a certain way. And this is how sometimes we end up realizing that this is actually institutionalized, because collectively we're all preparing ourselves to come across a certain way, to come across safe, to survive whatever journey it is. And so yeah, I think these things always end up being interlinked when you see how we address the things that we're labeled, and how we also want to present ourselves, and how also we're then perceived when we call out what is wrong. Yeah, so it all kind of just connects together.
Thank you so much, Trish.
Sandra, could I just
Oh,
caveat on
go
that?
ahead. Go
Just
ahead.
to
Yeah.
add, there is an intersection as well. And when we look at the certain things are statutory, right? And you've got mandated policies that state, and if I lean on to the send aspect of things, I have an educational healthcare plan, which means there is a duty of care and I have rights, my child has rights. And then you will look at the treatment in terms of what I can access, or what would be put on the table for me, or what pathway, the professionals will lead and go down, compared to my counterparts, where their children will be given a whole different experience and they'll give a whole different outcomes, but they have the same mandated legal binding document that stays with a child from diagnosis until they're 25. So it's not something that's imagined or created. You look at it and think, well, hang on a minute, how comes we have exactly the same thing, but my options are different? You weigh it up and think, well, it can only be what we're calling it.
Thank
Yeah,
you so much, Fiona.
sorry, just to add on to that a little bit, because you did speak about the scent aspect. Just to add on to what Fiona says, again, I found that I had to fight so hard for my child to be diagnosed. I found that I had to fight so hard, even the housing system, constantly having to remind them that I'm dealing with a scent child, and I don't know any of my white counterparts who has experienced the difficulties I've experienced in different sector. And this is why it's institutionalized, is whether it is housing, whether it is birthing, whether it is even the Senko department itself, the schooling, in all different aspects. I'm constantly having to fight for either my own rights or my son's rights, constantly having to remind them that this is a sent child, constantly having to find myself asking for my child to be humanized and for his needs that I've been diagnosed to be catered to. You sort of assume once I get the diagnosis and the EHCP, everything is right there, is clear and sound, but constantly having to actually remind the local authority that actually you guys have got his EHCP. Why am I reminding you of this? Constantly having to speak to the school and say, actually, this is what's in his EHCP. Are you guys actually inserting this? Or there's also little things like making sure that your child's EHCP and the fundings, he's actually benefiting from it and is not split all around. So there's little things that seem so micro, you can almost miss it if you don't know what you're doing. And unfortunately, a lot of parents aren't professional at this. They still need a lot of guidance, but we find ourselves becoming almost a care coordinator of our child's needs rather than actually also getting the support that we need, because we're constantly fighting to make sure that the things that are on paper are also being transverted and translated to the support that we actually should have access to in real life. And that's in all different sectors, and that's why it's institutionalized, because it's not a coincidence. It's not just happening with housing, it's not just happening in the TV world, it's not just happening with my motherhood journey. It's happening in every aspect of my life. And you know what's so common is that in all these aspects of my life, I am Black.
Wow. 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 Trish, that was so powerful. Susan, please just share your initial thoughts on what Trish and Fiona have just shared, but also your definition of what a safe space looks like.
Yeah, that was that was a lot. Thank you so much, Fiona and Trish, because I related a lot to everything that you said. I think my experiences as a mum, probably similar to Fiona, where it spans over years. So you've actually got a chance to notice the changes in care over time, in your area, from health visitors to from maternity services and things like that. I definitely echo what's been said. It's from things such as it made me think of my experiences of going into birth and thinking about how I'm gonna appear, how I'm gonna look, what am I gonna wear, making sure my hair was done, not just done to being so that it's taken care of, that I don't have to worry about it, but it's so that people think that I am, not poor or not not well put together. So being conscious of that, and in the work that I do, I've also become more aware that I have a privilege as third generation immigrant to the country, in that I speak my English. English is not my second language, so I don't suffer a language barrier. And now in my work, I'm supporting women who do have, they speak really good English, but it's not their first language. And so they're now in a medical setting. And I just think about their experiences, and I just think, and then I know the statistics for it are even worse. So we're looking at 25 times worse outcomes for women where English is not their first language. And if you couple that with being Black, you're just thinking, this is we have to we have to make changes in these areas. But coming back to, I guess, the safe spaces, for me it started definitely in lockdown, that it kind of drove home how important it was. I was working as a maternity champion in my local area, was volunteering at the time, and that we had to switch everything. We had to move completely remotely, and I started offering online support. I was a breastfeeding peer supporter, and I started doing WhatsApp calls and video calls to support women with their breastfeeding journeys. And I think it was such a shame that the NHS had nothing in place for such a situation. And this went on, for over a year. And the community just had to scramble together and put something together. And we were doing it in little pockets. And I just got out there. I just got in my car, went to the community centres when we could start meeting. And we were meeting masked up, and it was amazing what we could actually do over the phone and video calls. But it shouldn't have had to be like that. There should have been something already thought of and already in place. And myself, I had a baby. My last child was born in 2021, so I experienced the changes in the birthing facilities, and it was so sad. It was so sad. So I just think about safe spaces. We need to, they need to be in place, and they need to be something that we can rely on, and they need to be familiar to us. I've been used to Facebook groups and things like that, but having something where you can actually get to know each other and build on your similarities, but also, okay, I'm over here, I'm in West London, I'm in South London. There's so much more that can come from it, but you would never have met these people, because most of us, we can get a bit secluded as mothers, especially in the early years. So yeah, safe places to me are incredibly important.
Thank you so much for sharing that. And exactly, when we like talk about safe spaces for Black mothers, we're not just talking about, you know, a physical room or a meeting. We're talking about building spaces, whether it's in person or digitally, where mothers can really feel seen, where they can feel heard. And that's why this year's theme is making Black mothers visible. And I feel with safe spaces, we want mothers to feel like they are being seen in every single way. And I know Trish and Fiona touched on, you know, Black mothers often being simultaneously battling with, you know, SEND child, navigating housing issues, having to fight for your rights, having to constantly confront racism on a daily basis. We're kind of seeing this sort of like, I don't know, building block of multiple issues that make then access either really difficult for safe spaces or almost onerous, when you just feel like actually it's easier to just suffer in silence. Fiona, Trish, you guys are nodding your head. Do you think Black women naturally want to suffer in silence, or Black mothers want to suffer in silence, or
No.
do we want that support? What do you guys say when I say that?
I think we want the support. We definitely want the support. There's a pattern of events that can happen. There's sometimes where, like, do you know what? In order for my child to get a better experience, I'm going to move out of areas. I'm going to go to predominantly areas where I am a minority so that I can get. And then a lot of people are faced with something totally different when they get there. That's when they realize that they're othered. During the pandemic, so we had a contract through MOPAC, which is Mayor's Office of Police and Crime, working with mothers coming out of the CJS, which is the criminal justice system. And I'm telling you, the stories that unfolded during that period, Sandra, I've shared them with you. It was horrendous. It sounded like a Netflix movie. But the other thing I must say, there is a really interesting documentary on Netflix at the moment around Hurricane Katrina, which was back in 2005. And it's interesting because my daughter was born 2004 and I didn't even realize it was that long ago. But it talks about just how a population, so what Susan alluded to in terms of her just getting out there and rolling up her sleeves and going out to the community, like, we have had to find solutions to our problems. We've had to be that aid. We've had to lean on each other, right, to go out there, because the support from the system, if we're awaiting for that to happen, not to say it's not there, but the fight that you have to fight to get it. I'm currently homeschooling. I had to take my son out of a very hostile environment because it wasn't working. And I decided, right, and I'm grateful for the option that I do have to do that, but I've got what's called an EOTIS, which stands for Education Outside of School. I've had to fight the local authority to ensure that my son gets what he needs. So they pay for his tuition. However, a lot of people don't know this, and I'm finding it is about access, Sandra, and it is about us being able to share the information. And when we create these safe spaces, we're able to foster conversations, have dialogue, share with others how to navigate this system, who to talk to, not to like take no, because you cannot. You have to literally kick these doors open, because they will not just be ordinarily open to you. They're not. So there is a fight. It is about having strong allies, key advocates on your side to ensure that if we're dealing with equity, we cannot use these pretty buzzwords, right, that mean nothing to a certain demographic. Make equity equitable for us all. That's what I have to say.
Fantastic. And absolutely, you said, you know, so much. Sorry, Trish, was you trying to speak? Just wanted just to quickly link to what Fiona said, is that often Black mothers, we have to lean on each other, which is what you said. I found really profound, and that's how we started the Motherhood group, was literally 9 years ago, trying to navigate a very difficult system that you didn't really see yourself visible, creating your own platform, creating your own system that can provide that more of a holistic support, more of a community support, more of a peer-to-peer support, where mothers can feel safe, can share information, exchange resources, and essentially give each other strength. Because you'll find that this journey, this maternal journey for everybody, but especially Black mothers who have other compounding factors, we have to encourage one another. And that's why these spaces aren't just about emotional support only. It's about making sense of experiences, navigating challenges, and refusing to feel isolated or invisible. Trish, take it away.
Yeah, sorry, I was just going to add on to all of that in terms of the intersection side of things and this Black mothers being sent, having sent children. I just wanted to also point out that actually, when it's not just that we're also parenting sent children. I think to some extent, some of us are also sent children who have been masking for a long time. So
Wow.
when you ask that question, is do Black women want to suffer? No, we don't want to suffer, but we have been masking for such a long time that suffering has almost become our normal, despite feeling the discomfort. Because as humans, you feel that discomfort of suffering when you are also congratulated for the resilience you build because of suffering. You are almost kind of hushed into carrying on because that resilience is admired and you don't want to lose it because the resilience has come from a large part of suffering. And so when people are congratulating you for suffering, to some extent, you gaslit yourself into thinking, okay, I should carry on because I'm doing so great because of the suffering that I've been going through. And also another sense of masking is also how underdiagnosed that we are ourselves. As I said, I've got a sent child, but for a long time, I didn't know that I was also my mother's sent child. I was diagnosed with ADHD at the age of almost 35 this year. But I've always known that there was something quite different about me in the way I process things, my sense of anger towards injustice and unfairness. I think, Sandra, you saw it at the Big Brother house. And this is something that I'd mentioned because the referral was done even before I was on the program. But whilst mentioning that to the psychologist, she kind of just shrugged it off and said, oh, maybe it's just trauma. Even if it is trauma, there's something about trauma that has rewired the way my brain functioned and the way I perceive the world. And that was something worth exploring and seeing how things would impact me. Instead, it's kind of swept under the carpet. So then when things that are bigger happens and I suffer even more, I learned that I had to sweep things under the carpet because this is the routine that society has taught me. So no, we don't want to suffer. But if we have only survived by going through suffering, then we will think that we have to keep going through it. And so these spaces, what it does, not only does it allow us a community, it also allows us to be seen and our vulnerability be accepted. The first time that I thought, you know what, maybe it's not so bad that I may have ADHD was when speaking to the founder of Black Sen Mamas. And I was telling her, yeah, I think I've got ADHD. I was diagnosed with dyslexia a long time ago, but, I think there is more. She looked at me, she was like, oh my gosh, Trish, I can see it. And I was like, can you? She's like, yeah, I can. But it was a joyful conversation. It wasn't a dismissal, felt some sort of shame, felt like I'm lacking in something. And then we was able to have that conversation of the strengths of ADHD and the weaknesses and how I navigate the world. And so for me to only discover that way after my son's own diagnosis says a lot about how much the digital space opens us up to that comfortability and safety. And also it gives us an opportunity to also overcome some of the symptoms that we may struggle in having these conversations face to face, rather than going to a meeting with mums. I just get to log in online. I don't have to overthink getting ready, how overwhelming it's going to be having to deal with the world, traveling, am I going to get the wrong buses? So almost a lot of my symptoms being a sent person goes out of the window because of the online safety as well. And so it covers Black women in that aspect of the undiagnosed tribe that we all have here, but
Yeah.
we're able to kind of find that safety and discuss
Yes.
it.
My goodness. Thank you, Trish. You touched on so many key themes. And I know you've also downloaded the Motherhood Group's Black Mums app. And I know you've joined a few sessions where we've had antenatal classes, group therapy classes, peer-to-peer support classes on there. And we have right now over 8,000 Black mothers on the app. But you also touched on trauma. And I don't think that gets spoken enough when it comes to maternal care or maternal mental health care. And it's real and it's a lasting issue for so many Black mothers, whether it's from pregnancy and birth or just the daily pressures really of navigating inequalities. And trauma gets, as you mentioned, swept under the carpet, and that silence can instigate stigma, or making you feel like actually I'm being dismissed by my community and also dismissed by services. But silence, we know, only deepens isolation. Susan, you've got your hand up. How do you think digital support can offer a new way forward whilst destigmatizing issues around maternal mental health send children or other challenges that Black mothers face?
Yeah, I mean, I'll firstly say I put my hand up to just as you guys were talking, it just kind of it reminded me that peer support is actually the original motherhood model. So
Wow.
when we talk about, it takes a village, we're literally meaning that, yes, we know you're not supposed to do it alone, but actually you are supposed to do it with others alongside you. And that is what peer support is. It's someone who's already been through it, or even at the same time. And that whole meeting up, maybe for a coffee or just a quick message on the phone, that is peer support. It comes in so many formats. And it just reminded me that it's older than we can even dream of. And we are just making sure that we can always access it, if it's remotely, if it's on the phone, if it's on video call, if it's messages, and also in person. But yeah, sorry, Sandra, what was the other question?
No, you're spot on. Literally, you touched on so many aspects, but just how digital support can offer a new way forward. But you really kind of covered it. I know we've got a few questions in the chat, and I know we've only got about 10 minutes left. So I'm just going to read a few comments and or questions. I think let's start off with. I'm going to read Laura. Hi, Laura. You're in the chat. Laura Bridle, who I know is part of the King's College Hospital. When this happens, we need to complete DATIC's in-phase report and take it back to our interpreter translation services to see what they are going to do about it, as we pay them a lot of money and we have to back up plans when you do not get an interpreter. Heartfelt thank you for this conversation, powerful voices. This is not evidence-based, but there is a lot of evidence to show that who's not to speak English as a first language have worse outcomes. Embrace the dedicated report to this last year. There are some national and regional works happening in this area. I know you touched on language. I don't know who else wants to quickly touch on interpreting services or translation, because I know for many Black African communities, I'm Nigerian and my parents speak Igbo, but English also is very much spoken. So when we're talking about language interpretation services, I think we need to touch more on communication styles and in that retrospect, because I think language can be more nuanced, and I think we need to look and just kind of like address the elephant in the room, that it's not always about another language. It's about how we're spoken to, what type of language we're using, and also other types of barriers when it comes to our care as a whole. I know, Fiona, maybe you can just touch on that nuanced conversation around language and communication.
Yeah, language and communication is everything, because that's what we have, isn't it? In terms of how we understand things and how people will respond to us. It's interesting that you touch on that, and I'm going to go down the same route. My son recently had his speech and language assessment review, and it's just been updated. And the way that the brain processes. So if we're looking at, neurotypical people who understand in a certain way, even if you think about us culturally, how we will communicate with our one another and be able to say, right, I understand certain cues that you're actually saying and stating. Sometimes even us in our community, our facial expressions are kind of colorful at times as well. It don't mean that we mean bad to other people, but we're expressive people, and there's times when I have to say to my mum, can you stop frowning? Why? And she ain't upset. She goes, I don't even know I'm doing it. I said, Mum, you look angry. She's like, I'm not. There's just little things that we will do expressively, because culturally that is the way that is. And even if you're trying to communicate something to, say, somebody who English is not their first language, or there is different language barriers, there's ways that I suppose we will raise our children traditionally. I think last year, Sandra, we touched on the different things culturally that we do. Remember when your child had hiccups, my grandma said, put a piece of thread on the forehead, and when my breasts were engorged, put cabbage on the breast, all of that, those things that we will do. But language, if we're looking at how to speak to people that they don't feel fresh, because there's times when you have to think, am I just sensitive, or am I being spoken to like I'm
Yes.
stupid? And I'm like, I'm not, I'm not, I know I'm not stupid.
Yeah.
So do you understand what I mean? It's like, how does that, the thing is we're not always going to get it right, because humans are human beings and there's human error. And sometimes there is those misconceptions of when people will be able to say, I understand, right? Or, I get what you're saying. So it's, if you're trying to look at the language barriers or the communication, I think things are getting a bit better. If you notice now, when you're seeing posters and leaflets and different things around the place, they've got it in different languages, and it will be probably tailored to what the most common language in certain areas are spoken. I've worked with a number of like East African, Somali and Muslim women, and I remember when we were running programs, culturally they do things very different. I mean, they wear hijabs, I don't cover. So I had to take my time when I was running certain projects to get to know that community. What was the kind of social cues that was also appropriate to them, and the way that they raised their children, they did things, was unfamiliar to me, but I was open to learn and be respectful to the way that they do things, and speaking a language that we somehow found that commonality. And that was when we was running like sewing programs and other things. So there is different ways of, I think if you're interested in wanting to, embrace cultures and embrace, maybe how people speak, articulate, communicate, and what's the best way to do it, you've just got to be willing to do that without thinking that they're not going to, because many people, I think that English may not be their first language. When you express an interest in their culture, or you're asking, like, they're really excited, they're actually like, wow, you want to
Yeah.
know, you want to, they
Yeah.
feel like, oh my gosh, these people are
Yeah.
really
Yeah.
interested. So it's nice, I think, and it's such a, we're learning so much when it comes to language.
Thank you
Can
so
I
much,
just
Fiona. We have literally 3 minutes left. Can we just go around and just share one thing, one takeaway point that services, practitioners, organizations should know when it comes to Black mothers, our well-being, maternal health, mental health, and support looks like? Trish first, and then Susan, and then Fiona.
Okay, so I would say there is definitely a crossover when it comes to language and SEN as being SEN as well. And I find that people often can get the two confused. You can assume that someone's language ability is limited, where it could be a symptom that's actually showing up and that's completely being dismissed. As Fiona said, if you take an interest, you would always get something out of people, even if they're not speaking in the way you speak. If you actually communicate and try to see their capacity and also get to know their history, you can get a lot out of them despite the limitation in language. So I'll say it's really important to always look at the history. Also, maybe try to explore if there is anything that's not on paper, because when I was having my son, a lot of I didn't find that a lot of healthcare professionals were interested in even finding out what my miscarriage before him, how that impacted me, how that's playing out now in my concerns for him. So I find that you really have to explore people's past traumas, language, and whether they're SEN themselves or even suspect themselves of being SEN, because that then allows you to be able to relate and communicate in a way that actually delivers what you need to find out from them in order to help.
Thank you so much, Trish. 5 seconds. I'm so sorry, Susan. But before we go on to you, I can see Lauren, a comment or a remark in the chat. Lauren says, digital spaces have literally changed my whole motherhood experience, especially when I was struggling to get out when my daughter was younger. Such a relatable conversation, especially as a neurodivergent parent. Thank you for that, Susan.
I think to the health professionals who are on this call, when we talk about language, we're really thinking about the things that you already have in place and whether that you know how to use them. Even if someone is speaking English, when English is not your first language, being able to, there are some things that cannot be as well understood or expressed because it's their second language. So offering the services of translation services is important, and you as a health professional knowing what is available, what you can offer is incredibly important, and that's what supports women really well whilst they're utilising the services. And in general, in terms of mental health, the same thing that Fiona said, taking your time and showing an interest and not making them feel othered. They are in front of you. They are the person that you're caring for. And yeah, so those are the takeaways that I've got.
Thank you so much, Susan, for your contribution. Also, Lydia in the chat said, I think it's also important there is a lot of generational and previous trauma regarding support from the system. So some may be aware of the support available, and some may not believe or want this due to experiences. It is important to also break these barriers. Thank you for this space today. Fiona, just 5 seconds. What would you think we need to tell practitioners?
I'm going to keep this super sweet because I echo everything Trish and Susan said. Now I'm going to put it back to the practitioners. Mothers who are giving birth, you're at your most vulnerable. Say to yourself when you're dealing with people, how would I like to be treated in this moment? How would I like a professional to handle me, talk to me, speak to me, care for me? It is at a time when if ever you need care, because you're unprepared, a lot of us, as to what's going to happen and what that experience is going to be like. And it shouldn't be the case that once we've birthed our children and we've gone through what we've gone through on that aspect, then we've got another fight through the education system, through this, we've got to deal with so much stigma, systemic racism, institutionalized. Right? Come on, give us a break. Well, how would you like to be treated? That's what how would put the lens back on you, shine the light back on you. How would I like somebody else to treat me? What would I like? Let's bring some love into the room.
Thank you so much, Fiona. This is only day 3 of Black Maternal Mental Health Week. I want to just thank our panelists, Trish, Fiona, and Susan, for sharing your wisdom and experiences. Thank you so much, Grace and CNWL and the MTLC service for co-hosting this session. We've spoken about so many key themes. Please, guys, this is just a stepping stone, a crumb of the conversation, the wider conversation. Please use this as an appetite to research more, to learn more, to train your staff more. The Motherhood Group, we run training sessions, 3, 4, 5-hour training sessions to support, to show you guys and teach you guys how to support the Black maternal experience holistically. And what we've heard today really reinforces the power of safe spaces, of peer support and digital tools. Please, guys, get involved in our platform, support our platform, Black Mums app. We have, as I mentioned, 8,000 Black mothers on the platform across the UK, not just London, as I saw in the comment section, but we also need your support to signpost, refer, but also join the platform. If you would like to collaborate and run sessions on the platform, we right now have NCT who are delivering weekly sessions for Black mothers that are making it free and accessible. We know that also access is a massive problem when it comes to Black mothers having these safe spaces. We have SANS charity supporting our work, who are going to be running sessions on there as well. And we also are having group therapies, mothers coming together, talking about issues that matter to us, helps our entire experience feel a lot better. If you would like to know more information, please just go on our website, themotherhoodgroup.org, and we can reach back out. Thank you guys so much. And we have another session this evening at 8 p.m. for any Black mother on the call today who would like to join our weekly group therapy sessions with a qualified psychologist, Daniela. Please do join our sessions. It's free of charge, and you don't have to show your face. It's completely anonymous. And then tomorrow we have our conversation around inclusion, communication, and access. And then Friday we are streaming our Black Maternal Health Conference, so you'll see myself and Fiona online again, but it's streaming from the March conference. Thank you guys again, and take care. Bye-bye.
Thank you, Sandra. Bye, everyone.
Thank you. Bye.